Thank you very much, OSWB. Thanks a lot, Dr. Subhashishnath, and thanks, AIRS, for giving me this opportunity. Uh, Unfortunately, I'm not feeling good at all, so I made this unreasonable request. So taking you forward without any delay, my due is to talk on modifications in training modules in ophthalmology. So we've all come to understand one thing very clearly, that there has been a disruption in the normal life at a very unprecedented scale. But with time, we've also read and heard that there are different educational institutions world over, some more, some less, who have come forward with academic activities. So why would ophthalmologists stay behind? Just 1 minute. So basically, there has been three major crises which has to be understood. There has been a significant impact on the theoretical and the surgical training, number one. There has been an impact on the stress levels, and definitely that could have led to a mental ill health in our young students. And there has been a complete disruption of this whole machinery. And unless something emergent is done, it could actually be quite unfortunate. Sorry. So then the time has come to change. In fact, the time had come to change a little before COVID itself, because there comes always time when we need to look into our standards and keep revamping them. And we need it to move away from the century-old standard lecture-based approach we've been having at a various level. Of course, there has been great improvements in the Diplomat of National Board education modules and all that. But there has come the time where we need to integrate our newer technologies. We need to understand the need of our students, and we need to understand that we have these younger guys, younger teachers with great potential and capability to deliver the best, and these two young guys need to be enrolled in. We need to compare with the newer curriculum which is there world over, and probably look about setting out a uniform structure which would unify the entire country. And this is an eminently possible situation. We've been having an explosion of webinars, and definitely PG webinars at different state levels, but probably we could start addressing each of these things like a theory or viva voce and multiple choice questions, everything in greater detail with a focus that these postgraduates need to be addressed. We need to actually change our day-to-day patterns too. A program schedule probably needs to be created for 6 months, but the more we look into it, it could be that we need to do it for a year too. And we need to focus that the first year postgraduates and the final year programs need to differ, because there is a great stress on the outgoing batch because of the huge limitation they have seen in the surgical procedures which they could do or they'd like to do in the last 6 months. So probably we divert the attention and focus them more, the exam-related approach, have tutorials on a webinar platform. We need to keep in mind that social distancing has to be there, but we could give them that extra attention which could elevate their mindset. We need to identify a small set of surgical trainers in each of these setups which have the postgraduate program. And all of us have to be realistic that time is no longer a shortage now. And of course, camps and patients for trainees are going to be poor. So we need to adopt possible solutions. We need to identify a trainer in each of these setups with a schedule which has to teach these postgraduate students in a stepwise manner, especially the youngsters. You could teach them the simpler steps and make them stand with you through the rest of the surgery with great attention to teaching them every step as it goes on. Encourage the students to actually trail their seniors so that in the regular OT, because even these senior surgeons have enough time to teach now. In other words, we need to ensure there's a closer binding with this young lot and dedicate a little more time towards education in these existing scenarios. We need to have simulation-based training programs wherever that is possible, improve their wet lab scopes, improve them like they have mentors who could show these videos which we keep recording in our theaters and sit with them in a specific case discussion and discuss the different steps of the procedure. We also need to understand that there does come a lacuna in our webinars. So we need to keep going back be very critical, keep reinventing ourselves, modifying the teaching modules so that we cover up those lapses, which is essential for these postgraduates in this pandemic period. Now, telemedicine is again an area where the postgraduates are involved, but we need to encourage them to read better, to deal with those individual movements, maybe even conduct classes so that they do something better in this telemedicine. In other words, every portal has to be now converted into more learning for these postgraduates. The need of the hour is to provide that extra novel experience. We need to recreate that atmosphere of an operating room or a clinic. We need to get those digital curriculums which are available. We need to start doing a little more of remote mentoring. We need to understand, yes, there have been gaps in our training, which has evolved over time because each of us have been very ambitious in the growth of the hospital and so many more dynamics. So we need to come out with novel solutions. Like we have n number of technologies in a hospital. We need to see to it that at this point of time, we encourage our postgraduates to be exposed to all these technologies which we might not have thought of earlier. We could even get in trained technicians or professionals to educate them better so that they optimize the usage of each of these special equipments. We need to ensure that there is a little more exposure in the subspecialty clinics because we do have time to do that towards them. So we need to diversify ourselves from those set ordained ways of doing it and take up those novel teaching methods which would accelerate the thought process of the youngsters. There is paucity of patience, but there is no paucity of learning yet. So what we need to do is to look at the modern digital solutions. We have to see that these virtual classroom teaching are actually converted into a library of virtual classrooms so that the student can keep going back to those classrooms and then discuss these with their mentors. There are different simulation-based exercises which have evolved. And even in India, we have that MSICS Indian version, which is an excellent versatile training area. The students have been involved in the COVID testing or in the ICUs, and the duties have changed. And there is a level of stress in them, and they even do not go back and meet their family. So we need to remember our days, our great youthful days, and we need to know that there is this lacunae which has happened to this set of postgraduates and try to open up this window of enhanced teaching for them. We need to be proactive to facilitate the exams, talk with the senior members of fraternity to discuss whether the exams which are getting delayed is done on time, the entrance of the postgraduate into institutions is facilitated better, the orientation program is done better. Because the other extreme is an extreme situation to dread, because we could easily slip into lassitude and self-pity and disrupt that positive environment. We need to utilize time properly. We could enhance their skills in writing journals, analysis of retrospective data, teach them something about research methodology, statistics, give them assignments, keep going back and reverting with the right answers. We need to understand that the shattering of ideals has to be harnessed, and let's get together towards this new normal. We have won many races, we could win this too, and let us challenge the system to withstand the brunt and ensure that the young buds flower and grow beyond their lifetimes. Thank you very much.
What an insightful